Let's go ahead and get started, everybody. Welcome. Good evening. I'd like to welcome you on behalf of the Northeast Ohio Liver Alliance to our Patient Roundtable, Symptom Solutions in Cirrhosis. I'd like to tell you a little bit about the Northeast Ohio Liver Alliance, also called NEOLA. We are a nonprofit founded in February of 2021 to educate healthcare professionals and laypersons about liver disease, advocate for resources, policy change, and public health interventions that prevent and positively impact liver disease, and to support research and public health interventions that benefit persons living with liver disease. Our mission is to promote liver health through education, advocacy, and research, and to support persons living with liver disease in Northeast Ohio. I would like to thank our NEOLA staff, Mark Abbott, Michelle Davis, and Aisha Kazem, and our board members in attendance, Dr. Awani, Dr. Carey, Dr. Taba, and Mr. Shamir. And also great thanks to our supporting sponsors, Gilead and Mallinckrodt. I'd like to introduce our speakers. My name is Mary Penko, and I will be the moderator for this evening. I am a liver transplant coordinator at University Hospitals, Cleveland Medical Center, and have spent many years working with patients with liver disease and transplant. Maura George is a nurse coordinator in the liver transplant department at the Cleveland Clinic. Maura has been caring for patients being evaluated for liver transplants as well as living liver donors for the last 6 years. She is a patient advocate and passionate about educating patients. Ashley Hepner is currently a hepatology nurse practitioner at University Hospitals Cleveland Medical Center. Ashley has spent over 15 years as a nurse practitioner in hepatology with prior experience as a liver transplant coordinator. Our goal this evening is to provide information on the most common symptoms experienced by patients with end-stage liver disease. And those are focused on itching, cramping, salt, and brain fog. And now Ashley will talk to us about the first topic, itching.
Thank you, Mary. It's a pleasure to be here this evening to talk to all of you. So we know that, the first topic that we're going to talk about is itching, or what we call pruritus. And I'm certain that many of you who are on here who either have liver disease or take care of people with liver disease, a lot of people will itch. And we can't quite figure out why we itch, what the itching's about. So we'll talk a little bit about what that could be and how we can manage it. So the fancy word for itching is pruritus. So what really is it? Pruritus, or itching, is an uncomfortable sensation, often an emotional experience associated with either actual or perceived disturbance to the skin that can provoke that desire to itch. And we've all been there before. Some of the symptoms, one of the most common symptoms associated with dermatologic disorders or in systemic conditions. It can sometimes be caused by a rash or accompanied by a rash. Can often cause open sores with a lot of itching, can cause discoloration of the skin from repeated itching. It can cause brown spots and scabs and red areas. Often can be diffuse, meaning all over the body, or can just be isolated in just one spot. And in some patients describe that this can be deep and intense, causing a large disruption in their daily life. Sometimes patients will talk about how they have that itch that you just can't scratch, you just can't get to it. So what causes it? Again, it could be dermatologic. It could be an inflammation, it could be or swelling, it could be an allergy of some sort that could cause a rash, that can cause that type of inflammation or swelling that causes you to want to itch. It can be systemic, similar to what we see in liver disease, which we'll talk about in a second. It could be neuropathic. It could be nerve damage that can cause itching. Even though it's neuropathic and sometimes that can be associated with pain, it can also cause itching. It can be psychogenic, a psychiatric condition that can cause itching. Or again, it could be environmental, an allergy, an irritant to an environmental trigger. So how does liver disease cause pruritus? Well, this is what we call cholestasis. Cholestasis would be the most common reason why people will itch. And what kind of conditions are involved in cholestasis or are caused by cholestasis, one of which is called PBC. which is primary biliary cholangitis, which is a chronic liver disease that causes itching due to buildup of bile in the bile ducts. PSC is a similar finding, a similar diagnosis called primary sclerosing cholangitis, although this causes scarring and narrowing of the bile ducts, which inhibits the bile to flow through the bile ducts, which can also cause itching. Some women will get intrahepatic cholestasis of pregnancy. This can happen while you're pregnant and cause profound itching and treated similarly to these other conditions, or sometimes even just high bilirubin will cause itching. Buildup of bile and obstruction of bile flow causes the accumulation of bile salts and bile acids that can trigger the nerve endings in the skin that can cause this itching. So management. So we always want to know, what can we do for this? Because it's the most annoying thing on the planet. So the first thing we can use is sometimes moisturizing creams to keep the skin hydrated. Sometimes that can be used like colloidal oatmeal, or very thick, like a Eucerin or udder cream or things like that, that helps to moisturize the skin. You definitely want to avoid hot baths, harsh soaps, detergents, and excessive sweating. That will trigger a lot of the itch. You definitely want to wear loose fitting clothes, try to stay in a cool and humidified environments. Tight fitting clothes will just cause you to sweat and cause that irritation of the skin to cause the itching. And obviously you try not to scratch, but you know, that's hard to do unless you're wearing mittens or tying your hands behind your back. You know, that's going to cause, the more you scratch, the more you're going to itch. So there are many treatments for pruritus, you know, besides topical treatments. And these are the things that we use in our practice. And for a lot of our patients who have liver disease or itching related to liver disease, excuse me, the first line is cholestyramine, which is a powder. And that is approved for itching related to clogged or sluggish bile. And it binds to the bile acids and the bile salts in the intestines to prevent that reabsorption into the bloodstream. If that doesn't work, then there's a bunch of second line things that we can do. One of which is ursidile, or bile, or it's a bile acid, or what we often talk about is bear bile acid that's used to keep bile thin. It also is used to dissolve stones and to keep bile moving through the bile duct, so those bile salts can't get into the bloodstream and cause that itching. Another common one that we use is naltrexone, which actually binds to the part of the particular receptors in the brain, opiate receptors in the brain, that trigger the nervous system that can also make you feel like you're itching. Sertraline, or also known as Zoloft, is an antidepressant that can help with itching as well. Phototherapy. That helps to regulate an overactive immune system that can actually be triggered, that can trigger the itching, which can contribute to skin inflammation and itching. That's actually highly effective. I have a lot of patients that do that. And obviously antihistamines, non-sedating and sedating antihistamines, so something like Zyrtec, Claritin, or Benadryl can be effective to help the itching, and topical moisturizing creams like we talked about before. But certainly treating the underlying liver disease, if possible, will also help with this. And there are several other treatments available through your liver specialist if this is something that you suffer from. So I'm going to pass it on to Maura now, who's going to talk about cramping.
I think you're muted, Maura.
I am. Thank you. Hi, everybody. I'm so happy to speak with you today. We're going to talk a little bit about cramping, which can be a symptom of liver disease. All right. Oops, sorry. So what are muscle cramps? So I'm sure you've all had muscle cramps before, but it's a sudden painful tightening of your muscles. It is very common in patients with cirrhosis. It can be as prevalent as 88%. And of course, they often happen at night and without warning. So, you just get ready for bed, you're comfortable and relaxed, and suddenly you're woken up by these horrible leg cramps. Why do the cramps happen in cirrhosis? So we have found that nerve dysfunction or an irritation to the nervous system can lead to cramping. as well as electrolyte imbalances, so low magnesium, low sodium, and low potassium, which often you could have with liver disease, as well as altered metabolism. So if your protein intake isn't great, that could also affect why you're getting these cramps, as well as fluid shifts. So that's when the plasma volume changes due to diuretics, which likely, if you have cirrhosis, you are on, or disease progression. So if your liver is getting sicker, sometimes these fluid shifts happen more often, which is one of the causes of the ascites, or the fluid in your abdomen, or your legs, the leg swelling. Some other possible causes could be from restless leg syndrome, which always, of course, happens at night too, it seems. Vein disease in legs, low hemoglobin, or medication side effects. So you could have a double whammy if you have cirrhosis and one or more of these things. So how do we treat these muscle cramps? So first, let's talk about some non-medication treatments, things you can do at home very easily. You can do stretching and gentle massage. You can especially stretch your calf muscles by pointing your toes forward and backwards if you're even if you're laying in bed, and sometimes that even helps while you're having the cramps. We also want to make sure that you stay hydrated. And I know that Ashley is going to speak to you a little bit about your fluid restrictions, et cetera, but please try to stay as hydrated as you possibly can, and definitely avoid any alcohol or caffeine, because that's definitely going to dehydrate you. Make sure you're exercising daily, however that looks to you. Maybe because of your liver disease, you can't really get up and walk around a lot, but some gentle stretching and just a little bit of walking, even if it's around your living room, it will help. You can also use heat therapy, so warm baths or heating pads. And we also want to make sure that you're following a balanced diet with adequate minerals. And diet's going to be important kind of throughout the theme of all of these slides. So at the end, I'm going to talk to you a little bit more about diet when we get to the next topic. So of course you want to try those things at home, but sometimes maybe they don't help and we need to add a little bit of extra medication. So if your levels of magnesium are low, you can certainly supplement. We found that vitamin E also helps, zinc, taurine, and actually branched chain amino acids, or BCAAs, which are, believe it or not, available over the counter, very, very safe. You can find those in drugstores, Target, any kind of vitamin shop or GNC, as well as, of course, on Amazon. And then one thing I do want to tell you is to avoid quinine, or it's what's in tonic water. I think that was an old-fashioned way to potentially treat these cramps, but we want you to absolutely avoid that. That's not something that we use anymore, because it does come with a risk of serious side effects like heart arrhythmias or disruption in your blood cell counts. Okay, so when do you think that you should talk to your doctor? You've tried the at-home things, you're on the medications. So if you do start to have new or worsening cramps that aren't resolved with these other interventions that we discussed, if the cramps are interfering with mobility or sleep, no relief despite self-care, we also might have to check your labs to make sure that your electrolytes are balanced. So we're going to look at your at your potassium levels and at your magnesium levels, et cetera. And we could potentially review that. So don't hesitate to contact your physician if you start to have new or worsening cramps. So essentially, muscle cramps are common but manageable. We're going to start slowly with some lifestyle changes in the safe supplements like the branched chain amino acids and maybe some magnesium if that's appropriate for you. Work closely with your care team to tailor your treatment, and always report persistent or severe symptoms. And next, I'm going to pass the baton back over to Ashley, who's going to talk to you about your favorite subject, sodium and salt restriction.
I feel like this is a very huge topic and it's something I talk about every day in the office. And it's a constant struggle and is probably going to be a very hot topic here to discuss. So what's up with sodium? What's up with salt restriction and cirrhosis? Why do you have to restrict the sodium? Well, I'm here going to tell you. Okay. I thought it clicked twice. Okay, so salt intake. Why is it important and why do we talk about it all the time? And why is it so important for people with cirrhosis to restrict their sodium? So patients with cirrhosis can experience increased fluid retention. That can be in the form of lower extremity swelling. That can be with fluid in the belly, which is called ascites. And it can definitely be related to salt imbalance and salt content in the food. There tends to be what I like to call poor communication between the liver and the kidneys to manage salt and water in the body. And in actuality, where salt goes, water goes. So the more salt that you take into your diet when the liver and kidneys aren't working appropriately, the more water you're going to retain. And sometimes this has to do a lot with protein, the amount of protein that's in your blood as well. So like I said, so the more salt you take in, the more water you're going to retain. And oftentimes it's challenging for us to manage the fluid retention in our patients with cirrhosis. It becomes quite a balancing act. So I like to point out that while sodium is in the body is important, it's an important electrolyte that we need to help manage the body's fluid balance, blood pressure, and blood volume. Too much sodium can also have negative results. As we know, too much of anything can have negative results most of the time. It is important to balance your sodium and fluid intake to prevent dramatic fluctuations in the sodium level in the blood, which can lead to complications. And again, it's a delicate balance when we're talking about patients with cirrhosis because they typically will have low sodium levels, which will make them want to eat more salt or take in more sodium, which then just causes more of a fluid management issue. So what impacts sodium levels overall? One thing that can impact your sodium level is drinking too much water. So increased water intake in excessive amounts, if you're trying to overhydrate, can actually dilute the sodium content in your blood. So that's one reason why sodium levels in your bloodstream can go down. Another way is diuretics or water pills. Most of our patients are on diuretics or water pills to try to pull that fluid out of their body to reduce the amount of ascites, but you can also get excessive sodium loss through the urine. People with cirrhosis have low sodium levels. The body retains fluid due to the liver's poor ability to make protein, causing fluid retention. So with that fluid retention, we have to give more water pills, and more water pills can drop your sodium levels, and you are thirsty because you're on diuretics, so you drink more water, and it becomes this kind of vicious cycle. Fluid retention can impact your sodium levels, dilutes the sodium levels in the blood, and the more fluid you retain, the more diuretics you need, which then can make your sodium level go down. And obviously as well, impaired kidney function. Kidneys are very important in regulating sodium and water in the body. And when they don't function well, often in cirrhosis, this will impact sodium levels. And oftentimes patients with cirrhosis also have kidney disease as well. So it becomes a little bit tricky. I think I hit it. Nope, guess not. Okay, so how much sodium can I have? That is always the question. Well, just for a field of reference, the average American diet is estimated to have close to 45 milligrams of sodium per day. And I think depending on how you eat and what you eat, it could even be higher or a little bit lower. On average, and the average intake we request or we try to counsel people on with cirrhosis should be no more than 2,000 or 24 milligrams per day of sodium. That's actually 1 teaspoon of table salt. So that seems like very little, but that's about how much 1 teaspoon of table salt is. And that could be your allotted sodium intake for the day. So how do I limit my sodium? That's how everybody asks. The easiest thing is to remove the salt shaker. Hide it, throw it away, give it to your neighbor, use it as, a weed killer, whatever you do, just get rid of the salt shaker. That's going to be the easiest thing for you to not to add extra salt onto things that probably are salty. The second easiest way is to throw away or donate all canned soups, canned vegetables, meats, fish, olives, pickles, all of that. Those that has tons of salt in it, and most of the time you don't even realize how much salt's actually in them until you start to do the calculations. They're loaded with salt to preserve them, and that's just the easiest way to kind of get rid of that, to kind of lower your sodium intake. So 2 easy things: remove the salt shaker and remove all canned soups, vegetables, meats, fish, olives, etc. And then we want to avoid or try to at least limit significantly all salty snacks, convenience foods, fast foods, all the things that are really easy to grab when you're on the go, when you don't have time to eat, or when you just need something to fill your belly. Stay out of the middle of the grocery store. That's where all the salty things are. Limit sauces and marinades with added sodium. You really want to look and make sure that they say no added salt or limited salt or salt-free. Then you can use it as much as you want. You also want to avoid anything cured, smoked. Yes, that means bacon and sausage. Lunch meat, unless it's low sodium. Most of my patients are like, "You're telling me I can't have bacon anymore?" And I'm like, "Oh, I'm not saying you can't have it anymore. You just need to not eat it every day." That will help with the sodium or the fluid retention. And then again, is with convenience, everybody's busy. We all have busy lives, so it's very easy to buy frozen food. So you want to avoid frozen meals that have more than 500 milligrams of sodium per serving. So again, some of these frozen meals and some prepared meals you may find, and if you look on the back, and I'll show you a label in a minute. Sometimes it's 2 servings, sometimes it's 3 servings. It may only say that it's, 750 milligrams of sodium, but that's for 1 serving. So if you eat the entire meal, you could go over your sodium content or your sodium intake for the day. I think that's what trips people up. So here's a label. So tips for reading labels, I think, is so important. I talk to my patients about this all the time. So you look at the serving size and how many servings are per container. So for this one, there is 2 servings, which is 1 cup, and the sodium content is 660 milligrams of sodium. So that's per serving. So if you multiply that by 2, as 2 servings were in this food, whatever it was, that's 1,320 milligrams of sodium in this one meal or whatever this was. So if you ate this and you ate the whole thing, you only had 680 milligrams of sodium left for the remainder of the day. So it's really important to look at labels, especially things that are prepared, and to really look and kind of make sure that what you're eating is appropriate for the serving size. Now, a lot of our patients will say, "Well, you want me to eat all this protein. I need this protein for my liver disease, but the protein has salt." Well, there are certain sources of protein that may have a little bit of salt that comes along with it, but if they're very high in protein, I think we can limit that. And I think that if most patients just stuck to not using a salt shaker, getting rid of canned foods, not having snack foods, then it would be a little bit easier for us to manage that sodium balance and that fluid retention. It's a huge deal. I've seen a lot of success in people who can be very, very religious about their sodium restriction in terms of managing their fluid and managing their ascites. So I think we'll email these out to you, but here's some resources and recipes for low sodium recipes. There's a lot of recipes out there for your own herb mixes that can also help to flavor your food. Things like Mrs. Dash you can get commercially, but you can also you can make your own herb mixes. But these are a couple of the websites that had some really good low sodium recipes that I often provide for my patients, just for some reference, so that it doesn't feel like all you're eating is twigs. Okay. So now we're going to move it back to Maura, and she's going to talk about brain fog.
One thing,
Thanks.
Maura,
yes.
before you started, it's Mary. I just wanted to remind people, I think I forgot to say this at the beginning, that if you have questions that you think of while we're going through, if you want to put those in the chat, we're going to have a question and answer session afterwards. And if you do that, we'd like to know kind of where you're from, whether you're a patient, a caregiver, or a medical professional. If you want to do that, we'd appreciate it. And we'll also be able to unmute people as well at the end if you just want to be able to ask a question. Thanks, Maura. Go ahead.
All right. Thank you so much, Mary. I'm glad you said something because I'm sure, Ashley, that is a hot topic. And I even have some questions that might be helpful for you to answer for everyone to hear. But next, I'm going to talk to you about brain fog, also known as hepatic encephalopathy, which is a mouthful. So we can say HE and just make it easier for everybody. HE is the confusion that comes with liver disease. It's a brain condition caused by liver dysfunction, and it occurs when the liver cannot remove certain toxins like ammonia, and that ammonia can build up in your bloodstream and go into your brain, which causes confusion and behavioral changes. And we're going to talk a little bit about what the HE looks like when it's mild versus when it kind of starts getting worse. So, HE happens a lot of times when you are constipated and you need to use the restroom. The ammonia can build up if you're not having regular bowel movements, and you can start to be altered in your thoughts, in your speech, in your movements. You could start to get really tired, and all of that is pointing you in the direction of essentially you need to have a bowel movement. So what we will give you is a medication called lactulose. And if you're lucky to one of those lucky patients that has to take lactulose, you know that it's not the best tasting medication, but it is one of the most important medications that you can take. So the goal is bowel movements, and we're going to talk a little bit about how to use that lactulose in the next couple of slides. So the cirrhosis, or the liver disease, which is the scarring of the liver, is why you likely have HE. HE can be triggered by many things, including constipation, but also infections can cause it. Even something as little as like a urinary tract infection could really start to make you feel confused and really can even land you in the hospital. Sometimes if you have bleeding from your stomach or from your esophagus, dehydration can also lead to it. Certain medications, and of course, electrolyte imbalances, which seems to be also one of our themes this evening. Some symptoms that you may recognize in yourself, or if you're a caregiver listening to this, you actually may recognize these symptoms in your loved one before they even notice it themselves. So it is important as a caregiver that you do look for some of these symptoms and kind of get started on increasing the lactulose before it gets too far. So confusion or forgetfulness, daytime sleepiness. This is one I hear about all the time. Mood or personality changes, slurred speech or even tremors, trouble focusing, and in the most severe cases, it can lead to coma. We have a grading criteria called the West Haven criteria, and it kind of shows you the stages of HE, which is why I included it. It's not important for you to have memorized, but it's important for you to kind of understand, you know, how do we look at HE as medical professionals? So 0 through 4, 0 is subtle memory or concentration issues. One is mild confusion or mood changes. 2, disorientation and slurred speech. 3 is severe confusion and drowsiness. And 4 is coma. Okay, how is it treated? So we already kind of mentioned lactulose, and I'm going to mention it quite a lot during these slides because it is the best treatment that we have. It helps to actually, oh, someone is not seeing the slides. I'm going to leave that to our tech crew. Is anyone else not seeing the slides? We're good? All right. So lactulose will help to remove the toxins, but sometimes lactulose isn't enough. Sometimes even if you're taking the lactulose religiously, even if you are staying hydrated, making sure you're eating the protein, etc. Sometimes you need a little help. Sometimes your physician can offer a medication called rifaximin or Xifaxan, which will actually help reduce the bacteria in your gut. And there's a theory that the bacteria in the gut is what puts off the ammonia. So the less bacteria you have in the gut, the less ammonia you'll have to manage. Some physicians will also offer zinc, which helps to metabolize the ammonia. And then, of course, we want to make sure that we're treating the trigger. So if you have an infection, make sure that you're getting to the doctor, getting on antibiotics. If you're dehydrated, make sure you're drinking water. And of course, if you're bleeding, you need to come see us immediately. And then, of course, avoid sedatives and alcohol. All right, so titration of lactulose. So our sticky sweet medication. You are allowed to titrate this. And I'm sure when you have originally gotten the prescription for it, they've talked to you about this, and you've probably heard it a million times, but it is important to know that you can take more or less of the prescribed dose of lactulose in order to achieve 3 to 4 semi-formed bowel movements a day. And that's going to be the prevention. So if you're taking lactulose and you're not getting 3 to 4 bowel movements a day, unfortunately, you're going to have to increase it and take more until you get there. If you're taking your lactulose and you're running to the bathroom, you're having diarrhea, you're having accidents, that's too much. So you have to try to kind of get the balance. If you have questions about that, please reach out to your physician, but you are allowed to do that at home. And it is helpful to kind of see, and also that can change. Maybe you only had to take 1 dose of lactulose yesterday, but today you're not having any bowel movements and you have to increase it. So this is an ongoing titration. Sorry, I think this is a little bit repeated, but we want to make sure that you're preventing HE at all times. Try to treat it before it gets started or before it gets too bad. You want to take your medications as prescribed and make sure you're titrating your lactulose. Eat a balanced diet. Stay hydrated. Avoid constipation, which the hydration will help with. And then make sure you're having regular follow-ups with your liver care team. And if you aren't seeing them or you have questions, please reach out. Try to use your MyChart. Try to get in at least to talk with the nurse. Anybody can help you if you're having questions about this or if you have concerns. And next, I want to talk to you a little bit about protein. I know Ashley mentioned it in her slides. I mentioned it in my previous slideshow. So I'm going to talk to you about how important protein is, how essential it is for your body, how it can be used for energy, and most importantly, how it's used to build and repair tissue. So some examples of some good proteins. These are the ones that don't have as much sodium in them and you can eat is chicken, turkey, and fish, milk, eggs, and lentils. Also, we want you to snack during the day. High protein snacks during the day is great. So breakfast, lunch, and dinner if you can. And then we'd also want to offer you some ideas for snacks. So nuts, Every little kid's favorite snack, peanut butter on celery. Don't just lick the peanut butter out like I used to. Eat the whole thing. And then do a bedtime snack. So that picture there is cottage cheese, but you could do string cheese if you don't like cottage cheese. And when should you seek help? Seek help if you have sudden confusion or behavior changes, difficulty waking up, slurred speech or tremors. And at this point, call your provider, or if you think it's very serious, of course, just go to the emergency room. Oh, and with that, we're at the question portion of our program today. So thank you everyone for letting me present.
Let's see what questions we have. Right now, I'm not seeing any. Well, Mark asked a question earlier about, is coffee good for the liver? Ashley, what would you say to that?
Yes, coffee is amazing for the liver, as long as doesn't taste like melted ice cream. Actually, coffee is very good for the liver. It's good for fatty liver. So those who may be struggling with fatty liver, it's one of the treatment options. And we recommend black coffee, but if you need a little creamer with it, that's great. But to try to limit the amount of heavy creamer, sugar, things like that, to keep it low calorie, coffee is actually very good for the liver. It helps decrease inflammation from the fat in the liver, and it's recommended anywhere between 3 and 5 cups a day. It's great.
How about, are there foods that can help with the liver? Are there foods good for my liver, Ashley?
So I think, food in general, I think, is good for the liver in, as healthy as it can be. I mean, certainly high calorie, high saturated fat, high sugar foods are not good for the liver. Protein is really important for the liver. Good sources of fruits and vegetables are good for the liver. Good carbs are good for the liver, and everything in moderation. So a good healthy diet is going to be good for your liver for sure. I know there was a question about milk thistle or detox powders. I think um, the jury's out on milk thistle. I mean, I think that milk thistle has its, and correct me if I'm wrong, but from what I've been trained and from what I know, I mean, milk thistle is good for inflammation in the liver, but I think that you have to use it in the correct form and in the correct amounts. And I think once we get to the point of cirrhosis, it's not really as beneficial as it would be prior to. Um, Adaptogens, about adaptogens and adaptogen drinks. I'm not an expert on that, so I'm not really sure, but I know that adaptogens are good as an antioxidant and things like that. So in theory, that could probably help the liver as well. Um, I think that if we can focus on a more of a clean, whole food diet, which is very tricky to do, especially it's not cheap. Sometimes it's not available, but the best that you can do is going to be good for your liver. And I guess one thing that I stress to my patients is protein is essential. You have to do protein. You have to have protein. The liver needs the protein to recover, to keep its function going, especially in people with cirrhosis. I know there was an old theory that patients with cirrhosis couldn't have protein. That is a fallacy. They need protein, not only to manage fluid retention, but to also manage, keeping muscles intact, keeping their energy up, and keeping them, healthy, so to speak. So,
Danielle, Danielle is asking about turmeric and elderberry tea and cinnamon.
I mean, turmeric is a good anti-inflammatory. And regular use, I think, is safe. I know I think there has been some cases where too much turmeric has caused some enzyme elevation, but generally it's safe for inflammation. It may even help with cramping in the legs as well. I often recommend that for cramping in the legs. Elderberry tea is, I think, very good as an antioxidant. I don't specifically know if it's going to do anything to the liver or benefit the liver dramatically, but I know it's a good antioxidant. And then there's a question about cirrhosis. Is it reversible? That's a tricky question. So I think, the first thing we have to recognize is that if if it's a true diagnosis of cirrhosis, then generally that's not reversible. Now, if we're talking about fibrosis, there are different stages of fibrosis, and therefore fibrosis in theory can reverse if we can manage what caused it to begin with. I mean, that's the overall goal, is to prevent progression to cirrhosis. Therefore, I think, depending on the degree of cirrhosis, if there's true manifestations of cirrhosis, nodularity on imaging, low platelet count, low albumin, some features of impaired liver function, then that's not reversible. But fibrosis in the early stages is reversible if we can get that under control.
There's a question about, does low sodium in the blood test in a cirrhotic mean the person needs more salt?
No. And that is a common problem. So if your sodium is low in the blood, that does not give you free will to start using a salt lick or, putting salt on your chips. That is a setup for disaster. Low sodium levels in the blood can be a result of too much diuretic, can be a result of cirrhosis in general, kidney dysfunction. There's a whole host of reasons why sodium can be low in the blood. That does not give you the sodium that you take into your mouth does not increase the sodium in your blood. It does not. That's just not how it works. And the more salt that you take in to try to bring your sodium up, the more swelling you're going to get, the more diuretics you're going to need, the lower your sodium level is going to go. And then they're going to restrict your fluids. So when your sodium level is low, that is not the thing that you do. 100%.
We have a comment from Pierre that says we should have a whole webinar on dietary and nutritional supplements.
I agree, and I will participate. What is fibrosis?
Yeah, Mark is asking, what is fibrosis?
Fibrosis is scarring in the liver. So we often use that term. It's a fancy term for scarring. It's scar tissue in the liver. So many patients will come into the office and tell me that they have stage 3 cirrhosis, or they have stage 4 cirrhosis. And I have to kind of back it up and try to explain it. So anything that causes inflammation in the liver can be caused by a million different things. Can cause, if it's extensive enough and if it's ongoing enough, it will cause scar tissue, or what we call fibrosis. And there are different stages of fibrosis: 0, 1, 2, 3, and 4. Once you get to stage 4 fibrosis, that's when it's called cirrhosis, and we drop that staging and we just call it cirrhosis. So often people will say, I have stage 4 cirrhosis, and that's sometimes true. They have cirrhosis or stage 4 fibrosis, or they'll come in and say, they told me that I have stage 2 cirrhosis or stage 3 cirrhosis. And that's not the case. That is not. Cirrhosis is stage 4 fibrosis. So I'm very good with trying to kind of redirect patients to make sure that the terminology is correct, because that makes a huge difference, because cirrhosis is a scary word. So stage 3 cirrhosis doesn't exist. Fibrosis is scar tissue in the liver.
Ashley, is this deck going to be sent out to the participants? I couldn't take notes fast enough.
Yes, I believe so.
It will be available on our website. We're going to have this webinar available on the website so that patients can look at it in the future as well, and you can refer other people if you have family members or know other people that might be interested in it.
Thank you.
We have a comment From Dr. Carey about itching and keeping nails short, wear socks or mittens at night to avoid skin damage. Great suggestions.
Great suggestion, Dr. Carey.
Nicole is asking a great question. What is the difference between compensated and decompensated cirrhosis?
I'm going to take that one too, huh?
You're taking them all.
I mean, I can, but I think you're going to
It's
do a
good.
great
It's
job.
fine. It's fine. So what is the difference between compensated and decompensated? So compensated cirrhosis would be someone who has laboratory findings of or imaging findings of cirrhosis and laboratory findings that suggest cirrhosis, but do not have any other physical symptoms. So I would say they haven't had a bleed, they haven't had an esophageal varice bleed, they don't have ascites, they don't have hepatic encephalopathy, they don't have lower extremity edema, they're not jaundiced, they just kind of have scarring noted on imaging and have a disease process that probably caused cirrhosis, but do not have the evidence of liver dysfunction, so to speak. So decompensated cirrhosis are those who are showing profound liver dysfunction. So very severe abnormalities in their labs, ascites, or have had a GI bleed, have lower extremity edema, those who are really showing profound muscle wasting, high bilirubin, jaundice. So that's where kind of compensated and decompensated come from. So hopefully that's helpful. But if you have, cirrhosis and everything's going fine, you're living a healthy life, you don't have any complications related to that, that's what's considered to be compensated cirrhosis. Anything less than that or more than that, where you're having side effects to it, some of these things that we talked about today would be considered decompensated.
Sherry is asking, can anything be done through diet to increase platelets?
If we're talking about platelet reduction because of cirrhosis, well, in general, I don't think that there's a whole lot in the diet that can improve platelets. When we're talking about cirrhosis specifically, the platelet drop is due to what's called portal hypertension or blood shunting away from the liver, and the platelets are getting kind of sequestered or trapped in the spleen. So there isn't a whole lot to do for your low platelet count at that point. And that's often seen in people with cirrhosis, is that their platelet count is low. Doesn't mean that your bone marrow is not making platelets. It's just they're kind of all getting trapped in your spleen because blood's getting shunted away from the liver. So there isn't anything, dietary wise that you can do for that. And there's really not a whole lot to do for it for the most part. I mean, in certain situations, we can do things to increase that platelet count, but there isn't anything dietary wise.
Next comment, protein is important, but what about red meat protein?
Do you want me to take this one, or are you?
Yeah, Maura, how about
Go
you?
ahead.
Well, I just feel bad, Ashley, but thank you. Great question, Dr. Carey. So
I'm good. I'm good.
in my slides, I did show a lot of what we call like lean protein sources, chicken, fish, turkey. So we do ask that you avoid red meat if you have liver disease, or I guess significantly limit red meat if you can. It can worsen inflammation. If you have fatty liver disease, that can attribute to, now Dr. Carey might have to stop me if I'm wrong, but I think that high intake of red meat is attributed to, fatty liver disease is attributed to high red meat intake. So no, please don't eat red meat if you can avoid it. Any other questions? Oh, thanks. I did forget that. Red meat protein may make brain fog worse. Thank you, Dr. Carey.
Is there anybody who wants to ask a question? I think you can ask to be unmuted. Or we can unmute you. Okay, we have a couple more comments. Where'd they go? What can caregivers do to support people with cirrhosis in general?
That's a loaded question.
Yeah.
No, I'm just kidding. I think what's important from my perspective in terms of caregiver support is, I think, to start with, I think, depending on the diagnosis, and I speak truly on alcohol-induced cirrhosis. I think one of the big things that caregivers can do is support patients in their recovery so that they can get better and that they can live a life without alcohol and hopefully, prevent needing to go to transplant. I think with everybody else who are not dealing with that sort of disease process, I think it's coming to their appointments, listening to the providers, getting involved in their care, asking questions, taking down information that the patient may not hear, that may miss because they're in a high stress situation. This might be a new diagnosis. Supporting them from, making sure that they're following their diet, they're taking their medications, everything, bringing them to their appointments, whatever. I think that a lot of patients try to do it on their own, and you can't do anything on your own. So I think patients are successful when they have family and caregivers and friends or whoever that can help support them along the way. A lot of times in patients, like what Maura was talking about, brain fog, they may not remember to take their medications. They may not remember to go to their doctor's appointments. They may not remember to get their blood work done. And understanding that there may be some resistance and understanding that there may be some, push and pull a little bit, but just being very steadfast and saying, this is what your doctor wants. This is what we need to do so that you can get better. Because especially people with hepatic encephalopathy, they're going to fight you tooth and nail. They're going to fight you. Patients are going to fight you to take that lactulose. They're going to fight you going to the emergency room. And you just have to, understand that it's for their own good, and to be supportive and, just kind of supportive in general. Brain fog and driving, I don't recommend it.
But I think that's also where a caregiver can come in too.
Exactly.
And nobody wants to be told they can't drive. I think losing that independence is really, really hard. But as a caregiver, you're going to be the ones that are going to see that first before the other person does.
Yeah.
So, I think to go along with the caregiver, the patients, maybe explaining things a lot of times, unfortunately, taking the keys away if need be. And being really understanding and gentle with liver disease, because it can shift. You could be very healthy one day and sick the next. And so it is important for you to have a strong social support system.
And I think, engaging with, the providers too. And, most providers probably are going to see a lot of this before the caregivers do. And it's important for us as providers to lay it out and to be kind of proactive and planting that seed as well. I've had to do that a few times to kind of, especially with driving, kind of plant that seed like, I think we're getting to the point where you can't drive. And sometimes they'll listen to us before they'll listen to any member of their family or friends. So don't recommend it.
Okay. See if there's anything else. Anything else? If we have any caregivers on the line, are there things that we as medical professionals can do to help support caregivers? Anybody has a comment on that?
I'm not a caregiver. I'm a patient, but I could tell that my caregiver could definitely use an outlet or a support system of like-minded people in the same group.
And we do have some resources locally, support groups that are available. There are support groups through organization TRIO, the Transplant Recipients International Organization. Social workers at hospitals and within transplant programs are vital to our patients and our caregivers. And the Transplant House of Cleveland also has a caregiver support group, I believe, that people outside of there can also access. And Dr. Golem is saying maybe Neola can help with potentially starting some type of a support group.
I think that's a great idea. I think caregiver support groups is huge.
Yeah, I agree. Thank you.
Especially in the transplant world, right? And even before that, I would say, even in the patients who are starting to get sicker, I think that's a huge deal, is caregiver support. And I think we're so focused on the patients a lot, which is great, but we also have to focus on the caregivers too.
One more question. What would you say intermittent fasting is helpful or harmful to someone with liver disease?
For me, I mean, I'm not an expert on intermittent fasting. I would say for people with cirrhosis, it's not recommended. I think that you're setting yourself up for either not getting enough protein, not getting enough calories, and not meeting kind of the nutritional requirements. I think intermittent fasting, if we're talking about people, let's say with fatty liver disease, intermittent fasting works for a lot of people, for weight loss and for metabolism and things like that. So maybe in that realm, it's a little bit better. I wouldn't recommend it for our patients who have fairly advanced cirrhosis.
Okay, well, I'd like to thank everybody for joining us tonight. I think this was a great session. We're really happy that you joined us. This is our first webinar for patients through Neola that we have launched. So I'm looking forward to more in the future, and we'll keep everybody updated on what our next topics are going to be. Thank you very much.
Thanks, everyone.
Thank you.